Okay, so we have a great start to the afternoon. Our session is entitled Making Sense of Information on the Web. We have two speakers for that session. Josh Mailman, I asked him what he wanted his title to be, so I think he's a friend, colleague, prior director of NorCal Carcinoid, patient advocate. Josh wears about 1 million hats, but he, I think in particular, has really contributed so much to patient advocacy for NETs and to many guidelines committees on which we sit together, and has really helped so many patients navigate a new diagnosis. And I think Josh is very well equipped to speak about this topic of navigating the web. And then following him, Carmen Huddleston is a Stanford health librarian and is also going to give you that perspective of really how can you take advantage of resources through the internet, through your local library, and through health libraries. So this is, we're excited about this session. We haven't done something like this before, so I'll welcome Josh up to the podium.
Good afternoon. Let's see if I can do this right. I can. If I do this completely right. All right. That should do it. Let's see if this thing's going to work for me. Did we plug this back in? No. Technology. Must plug in the receiver. Let's see if we got action now. Yeah, okay. I'm probably going to stand down here. Oh, except if I'm screwing up the video, guys. If I'm over here, is that okay? All right, so I'm going to talk about balancing information on the web. Probably I'm going to talk about just information because we're going to get overload. But first, I want to do some shameless plugs. This is the group that ran or walked in last year's Oakland Running Festival. We got over 50 people to raise awareness of NETs. It happens again on March 22nd in Oakland. We have 22 people signed up. We're trying to get a bigger group than last year. We had 50 last year, so it'd be really great. Just go to the NorCalCarcinet.org website to sign up. There's some pamphlets, and we give you great shirts and have a great time, so it's really a lot of fun. Please join us. Okay. No one's done disclosures. If you normally go to a medical conference, you have to give disclosures. Why are they important? Everyone has biases. We're going to talk a little bit about information and bias as well. You need to understand, everyone who gives you information, what their bias is. So here are mine. I'm on lanreotide. I was once on sandostatin. I've had 3 rounds of PRT. I chair advocacy for the Society of Nuclear Medicine and Molecular Imaging. In theory, I do that for the Society of Integrative Oncology as well. I'm not a doctor. My dad was. Those are the 2 groups. My background on the internet and on working in the web world is I co-created efax.com. Why is that important? Well, in fact, it was a great social experiment in having people have fax numbers, and then almost immediately, the 4th day after we launched the service, people tried to use social engineering to scam people out of their pocketbooks. 4th day into it, I had to learn more about abuse management and compliance management than I ever had any intention of knowing. I managed websites at NBC Internet, personal web presence, 50 million page views a day. I do manage a lot of societies' websites. I manage the World Association of Radiomolecular Therapies website. I manage, obviously, NorCal Carcinet. For 3 years, I managed the Society for Integrative Oncology's website as well. We'll talk a little bit about that, but that's my kind of background at the web. Just happens to be I'm also a neuroendocrine patient. So who are we? Did anyone expect getting cancer in this room? No, no one expects it, and the minute we get it, we're expected to become an expert really quickly. I actually wrote a paper that was published on the JNCI and the JNCI monograph that went with the Society for Integrative Oncology guidelines on getting past the war of cancer and living beyond cancer. And it talks a little bit about information. I'll talk about that in a little bit. But one of the things that I talk about in this paper was something that happens to all of us. So again, we did this at the beginning, but if you've been diagnosed in the last year, can you, since this is after lunch and we need to get some things moving, could you stand up for a second if you were in the last year? Well, welcome to our club, and if this is and you can stay standing. I'm gonna have everyone stand, don't worry. And if this is your first conference, again, stand up because there's even more of you, so that's really great. Okay, so you see you're among friends. You saw the survivors that we had as well. And now if you've been dealing with this or your loved one has been dealing with this, stand up as well. It's always good after lunch to do that. Now, the only people who get to sit down right now are those of you who within the first year of being diagnosed, having a diagnosis, did not have a friend, did not have a relative, did not have a loved one who came up to you and told you what the next superfood, what the next miracle diet, and what the next thing you should be eating. So all of those who didn't get hit on like that, please sit down. Now everyone else can sit down. So that's it. We get hit with this all the time. So where do we check? Who do we check with first? Well, turns out people do study these things. The first people we actually talk to and get information from, this actually comes from a University of Michigan study that I'll bring up in a second. Thankfully, for the most of us, we talk to our doctors. Doctors are the #1 source of information. Our personal networks are #2, and we'll try to hopefully have a little social experiment. We'll see how well that works. But our personal networks, our friends and family, are the #2. More and more, we're turning to the net. In 2000, that number was only 45%. 2010, when they redid the study, that number was closer to 90%. We're starting to turn to social media more. 45% of us, I don't know, let's see. Show of hands, people who are on Facebook or use ACOR in order to manage their disease. I'm gonna go that's less than 45%, but their study showed 45%. I'd say that was more like 25%. And it turns out that's age-related. Those of us who are over 65, that's not me, just checking. Turns out we use social media and the net a lot less than those others. So this was from the University of Michigan study. We most have broadband. The usefulness of cancer information from these sources deemed limited by the respondents. So most of you are getting it. Some of you have tried it, then get off, and then say, well, I went on the net, it didn't really do well for me. I'm gonna try to give you some rules to live by, or a little bit. I'm not gonna give you too many sites. There's a librarian who's coming up afterwards that will talk a little bit about this. I'll talk a little bit about what I've done. First thing, who uses the University of Google? Yeah, the University of Google, that's not how to get a medical license. No one gets a medical license from it. If you put in cancer cure, the number, it's 22 million responses. Did it last night. #1 was Cancer Tutor, advertising a 90% cure rate for 5 years. You got anything that does that? No, okay. Their big thing was chlorine dioxide to cure your cancer and give you a 90%. So that's #1. It's #1 because people are doing this. It scares me. That's why I thought this talk was to be so important, because we need to think about this. We need to understand that it's okay to look at these things, but also how to interpret these things. Cancer Research UK did a paper on the top 10 myths on the internet and debunked them all. I highly recommend you go look at it. Now, you know, cancer has a sweet tooth. Does that mean that sugar's okay? No, we just heard from a nutrition. Sugar doesn't help you, but these are and that, you know, superfoods are good for you, but they don't prevent you from getting cancer, but they're good for your health, okay? I look at these every once in a while and I realize that every week I talk to patients and I'm talking and trying to debunk a myth for them. I think this last one, Carcinoid Cafe people here, who's a Carcinoid Cafe person? Anyone? No. So the big one this week was myth number 5. Cancer is a fungus. Taking all sorts of bicarbonates will cure you. Taking lots of it actually could kill you. So, and the response was that when I said, look, here's some facts, I don't really, read what you need to read, but the response was, well, I'll try a little of extra, how could it really hurt you? It turns out it can. The other one was bitter melon, was the other popular one that came through my desk this week. What's wrong with taking a little bitter melon? It looks like it's curing pancreatic cancer in mice. I'm shocked you're not using it, George. The fact is that and it's a natural occurring thing. You can eat bitter melon, but it can have impact with other things like chemotherapy, and we'll talk a little bit about that. Great article from Cancer UK. So we really are looking for information online and support. As I said, I managed the web presence for the Society for Integrative Oncology for 3 years. I was also an executive board member for 4 years. The most downloaded thing, which is great that it's the most downloaded, was guidelines. You should be looking for guidelines. If you go to the NorCal Carcinet site, we have an entire section of the guidelines from North America, from Canada, from the UK, from the ENETs, on how to take particular tests. And in the SIO, the most downloaded article after events are the guidelines for integrative oncology. Those are good things to know, having guidelines. The second most article, which actually was fairly interesting to me, was the Guide for Credible Internet Information. So I wanted to talk a little bit about what that really broke down to just a few points. And these few points will keep you safe on the net, for the most part. If you see something, find 2 or 3 resources. Find 2 or 3 resources that aren't someone else's site that are selling you something, but find 2 or 3 medical or journal resources. Check the credentials of the author, what their background is, what their biases might be. See who's doing information review on the website, which is hard to do. Be wary of sites that are selling anything, right? If they're telling you something is good and they're selling it on their site, that's not really a place that you need to get the information from. If the information contradicts anything that your doctor is telling you, call your doctor. I have talked to my integrative oncologist is Donald Abrams. I have talked to him about any crazy thing that I see that I can't get enough research points on, and he will always at least give me where to find the relevant information on. Second thing, or last thing on this, social media is an N of 1. You're getting everyone's individual experience. Those of you who talk to me individually as well will know that I don't like giving out specific opinions because I'm an N of 1 as well, right? I like to refer you to other studies, other places where you can educate yourself. Remember when you're in social media that what you're hearing is a lot of N of 1. And N of 1s don't really tell the entire story of what's happening across an entire set of trials, entire histories of patients. I have something called telephone. Did that start? Did those? Oh yeah, no. You should pass those down, but now, well, that's okay. Did anyone play the game telephone when you were a kid? Yeah, so pretty much what happens on social media is it's a large game of telephone. One person learned something, and by the end of it, I was going to try to do a little telephone, didn't quite work out. So what usually happens is someone gets a snippet of the information right, and by the time the 32nd person is commenting on it, that information's completely wrong. So be wary of that and understand that. I'll do that a little bit. So time to wrap up here. Be safe, be informed, talk to a medical profession, talk to a medical librarian. They know resources better than I know the resources. Understands how bias comes in. look, you understand that when you're working with an oncologist, you'll hear things that are very clinical trial focused. There's nuclear medicine people here. You'll get nuclear medicine information. Some will require random control trials, some won't. But understand what their biases are as well so that it can help you make an informed decision, because we will get a lot of different information. It's not just from the web, it's also from the people we talk to. Understand the level of importance you need. When I talk about looking for 2 or 3 different articles, look, there are going to be clinical trials on multi-million-dollar drugs that need to go through having 100 people or 200 people that are randomized into different things. If you're thinking of taking turmeric or some other herbs that someone in the medical profession, as an integrative oncologist or an integrative medical practitioner will tell you, that level of detail won't be there. There'll be some studies, but the turmeric board can't spend $500 million to get that study. So you need to understand what level of information you're comfortable with, how well you can understand what the side effects of something can be. Make sure you compare apple to apples. And earlier today, we got a little bit of the lanreotide sandostatin information today. And we saw the plot on the on progression-free survival of lanreotide. So there's a lot of things going on that says, well, lanreotide gives you longer PFS, because that's what the study says, right? Longer PFS. What's the PFS of lanreotide? That was 28 months in the clarinet. And if you did the Sando trial, PFS on sandostatin was 14 months. They're not the same thing. Wasn't the same trial. So even though one had a different PFS, turned out the PFS, or progression-free survival, for the placebo arm, people who didn't get treated with lanreotide, was just about as long as people who got treated with sandostatin, who got the drug. So this is actually from a paper from Dr. Wolin when discussing somatostatin analogs, is direct comparison between octreotide and lanreotide could never be made. So I wanted to bring this as an example because even, last week, I'm switching to lanreotide because it has a longer PFS. It's like, or it has, better tumor suppression because has longer tumor suppression. Well, there weren't the same entry criteria. PFS was measured differently. All sorts of things can enter into that. So just because you have 2 trials, you need to really understand what they were, how they were done. And the other thing that I get a lot of times online, this is in PubMed, so it must be a good article. I was shocked to learn that there are 5,600 publications that are actually chronicled in PubMed. So it's not that hard to get something that's actually in PubMed. My other article was in PubMed as well, and I don't have a PhD, so you shouldn't really necessarily, not every article is something that is a great article or hasn't been superseded or someone else hasn't written a commentary on it. So just because you see a PubMed citation doesn't necessarily mean that you have a credible article as well. I will say I'm only going to show one website before I turn it over. A lot of times when I see different people asking about different things, the place I go, this is at Memorial Sloan Kettering. They run a really great website on herbs. The thing that I like about it is I can't shuffle through all the material that I need to understand, so they've done it. When you look up a particular herb, they'll give you a lot of information, and then they'll actually give you all the reference articles so that you can read the papers underlying and see what the kind of vetted research looks like, so you have a better understanding of why they came to how it is. They don't make any recommendations about whether you should be taking the herb or not. It more is, these are the side effects, these are the claimed benefits, these are the reference materials which we think are credible. So it's a really good website to look at. And with that, my few minutes here are over. So I thank you for your attention. I'll be around for the other part.
Hi, my name is Carmen. I'm a librarian here at Stanford Healthcare, and my portion of the presentation today is going to be finding credible information on the internet to help you make your critical healthcare decisions. As Josh was mentioning, there's so much information available on the internet today. Okay, is that better? Okay, I'm kind of short compared to my partner here. So. In 2012, the Pew Research report found that 72% of people who use the internet use it to find healthcare information. And of course, when you're doing those searches, you can get hundreds and thousands of hits and possibly even a million hits on the topic you're looking for. And this is fine if you're looking for, if you're shopping or something, but if you're looking for healthcare information, you need to find, credible, trustworthy resources. So when you do find these resources, when you get your results, how do you know which resources you can trust? One of the quickest ways to do it is you're looking at the URL, and this is information, by the way, that I got from the American Cancer Society's webpage. But if you look at their URL, look to see if it says .edu, which means it's from a academic organization or institution or college or university. If it says .org, it's usually a nonprofit organization like Caring for Carcinoid, Foundation. There's to be a .org. There's .com and .biz, which are commercial websites, and there's .gov, which are national and state government agencies' websites. So this is just, and then also there's accreditations you'll see on some websites. This is just one of them. It's called the Health on the Net code. You'll see that on some websites, you see it on some commercial sites, like WebMD will have it. And it just means that they follow certain principles. They do have to pay for this accreditation, so a lot of sites don't carry the Health on the Net credentials. They may have other ones. I know Caring for Carcinoid Foundation has the OncoLink Editor's Choice Awards. There's different ways that websites can show that they've been accredited or certified. And so when you don't know if a website doesn't have a code or accreditation, whatever, how do you know? Well, like I said, you can look and see what's in the URL. And then you also look at the About Us page or section on a website, and they'll have information on there, like what's the purpose of the website, who manages it, is it sponsored by, say, a drug company, like a single one, what's the mission, is it for patients, is it for physicians, who's the audience, but the really important thing to know is what's the source of the information on the website. Do they document it? Are there references? If there's an article on something at the bottom, do they reference the study or what research was done in creating that article? And also, who reviews the information? Is it being reviewed by a physician, a medical writer? Is it a patient, like in case of Josh? There's different reviewers, and you want to get different perspectives. You want to get the professional perspective and the patient perspective. So look to see who's actually reviewing the articles. And then also what's important is how up-to-date is the information. Because healthcare and medical information can change so quickly, every day there's something new on the news about some new treatment. That's really important to know that what the information you're reading is current. There might be a great article, but if it's 10 years old, may not be the best article for what the condition is or whatever situation you're searching information for. So again, piggybacking onto what Josh had mentioned, when the Society for Integrative Oncology has a list of criteria or ways to evaluate a website, and their first one they have listed, their first bullet point is compare the information you find on the internet with other resources and check 2 or 3 articles in medical literature or medical textbooks. But as a consumer, where do you find this information? You just can't walk into public library and have a selection of medical textbooks there. They may have 1 or 2 consumer health books, so they aren't going to have a huge collection. Well, that's where a medical librarian can help. We're here to help you find that information to back up whatever claims you've read on the internet. And I'll first give you a little bit of my little infomercial. Again, I'm with Stanford Healthcare, and Stanford Healthcare has the academic medical library, Lane Library, but we also have a branch of librarians, our consumer health libraries. It's called Stanford Health Library. There are 4 branches. There's one in here, right near there's one in the hospital, there's one at the Cancer Center, one in East Palo Alto, and then one at the Hoover Pavilion. And each branch is managed by a librarian and a staff of volunteers. Our services are free and open to the public, so you do not have to be receiving care here at Stanford to come in and use our services. And what do we do? How can we assist you? Well, we can assist you at any point in the continuum of care. If you're newly diagnosed, you want to come in and just find out about your situation, your condition, we can give you that information. If you're receiving treatment, you've just been put on new medication, on that drug, or let's say they're changing your treatment. Again, come in here and we'll give you information on that. We can make the information as specific as you want it. It's like we tell patients it's customized information. It's not just a book we're pulling off the shelf. It's actually, we'll go in and do literature searches for you. Josh, I mentioned PubMed. We'll search through those 5,200 resources out there, journals, to find information specific to your needs, whether it's you want something based on, again, like treatment, aftercare, whatever your topic may be. Complementary alternative medicine, we can help you find support groups, and also resources for communicating with your healthcare team. One thing we don't do is we don't interpret information or offer advice. So if you come and access, you've been given a choice of 2 drugs to take or treatment options, all we're going to do is we'll give you the information on both those things from evidence-based resources. We're not going to say, oh, this information is more on this, whatever. We're just there to give you the information. And we encourage you to take whatever we do give to you, take it back to your healthcare team so you guys together can make the best choice for your situation. On the resources that we use, we have our own subscription resources we use in the healthcare library, but being that we're part of Stanford, we also have access to the Lane Medical Library database of journals and resources there. The information is evidence-based, it's current, and it's authoritative. So it's not like what you're going to find on Google. If, like Josh was saying, just Google something and all the different hits you get. When we're searching, we're just going to go to those resources, those materials that we know they're going to contain authoritative, current, and evidence-based information. We have the information available at the consumer level, or we can have it at the professional level, or a range in between those. Whatever you want. Maybe at the beginning you just want some real basic information, but then after a while you say, well, you know what, I heard about this, or my doctor's mentioning this, so come back into us and we'll look for those more advanced information if that's what you're searching for. Do have some information in different languages. Again, if you come into our library and you want information, let's say Russian, we'll see what information is available out there through the resources we have access to. And we have various formats, so it's not just printed things from a database. We have a huge collection of ebooks available through the Health Library website. We have print materials at our Cancer Center branch. If you've ever been there, they have a huge print collection. These books can be checked out. You can borrow them up to 2 weeks or longer if necessary. There's no fee. Again, this is all free, so you can check them out as long as you want. So there's the print materials, and we have DVDs that you can check out if you want videos. And we also have videos online available through the library website, and these are videos of lectures we've had at the library on various conditions, healthcare conditions. So how can you contact us? Well, you can come into the library itself. Like I said, we have 4 branches. I have some flyers with me today I can pass out to you if you're interested. You can call us directly. This is the phone number and email address I have here is for the Cancer Center branch. So if you come to see me afterwards, I can give you some cards. But definitely come visit us, or go visit wherever you're located. Your consumer health library. I know UCSF has a consumer health library also. So definitely use the librarians, use the services that are available to you to help you get the information to make your decisions. Thank you. Did you want to do your? Yeah, we're gonna.
I was going to add, one of the resources when we're lay people and we don't have medical society subscriptions, we don't actually have access to some of the things that you think we should have access to. One of them that that we use at the Society of for Integrative Oncology that members get access to, and you also have available at the Stanford Library is the NCD, the Natural Comprehensive Database, which is there is actually a patient portal to it, but it's not as in-depth with as much information. So if you're trying to look up a natural remedy or a natural product and you want to see what its interaction is with other drugs that you may be taking or other interactions, you're going to get a lot more detail going through the Stanford Library than you would as a layperson entering it from the outside. And you'll learn more about what the real interactions are, because natural things, we have a tendency to think natural things are absolutely fine. No, they can be very potent. Arsenic is very natural. It will do a number on you if you decide to go take it. So this is why there are resources like this, and I really, if you don't have access to some of these things that aren't available and you're interested, please go see a librarian to take care of that.
So we have some time for questions, so if there are any, please feel free to get up. I'll make, as you're pondering your questions, I'll make another comment. So speaking of resources, I should have mentioned earlier, but the videos and the slides from today will be made available. Those will be available very likely on a number of sites, including the Stanford Health Library, NorCal Carcinet's Caring for Carcinoid. So those will be good ongoing resources for all of you. Yep, there's a question.
Yes, definitely. In fact, so probably one of the most common uses is if you're reading something, definitely, like I said, you can either email us, you can call us, and just give us the citation, the title, the article, the author, and the journal, of course, and then we'll let you know what information you take, like the volume number. But definitely, that's something we can do. We'll print it again. It's a free charge. So, I mean, free of charge. So it's.
The question was.
Yes. Most medical published literature is copyright protected, so it really depends. Some things are available for free through PubMed Central. If we can get it, if it's available for free, we'll send it to you the link. Otherwise, we have to print it off and mail it to you. Yeah. Okay.
The question was if you couldn't get access to an article that maybe you were interested in looking at, could you get that through a health librarian? And the answer is yes. Yeah. Any other questions? All right, well, I think these folks will also.
One more.
Oh, one more? Yes, Rob.
Josh, you mentioned a bit about guidelines and investigation. Are there any guidelines to help make people
Guidelines to help people through cancer jargon? Yeah, that's an interesting one. I don't know if there's there are some common. I'm trying to think of the. Well, for NET specifically, the zebra, Maria's book has some information on that, but the zebra, I can't remember the. Cure, the magazine, that would be for general cancer terms, and if I remember correctly, Zebra Talk, which was done by the Philly Carcinoid group, that is available as a reference, has actually a set of acronyms that are used in working with neuroendocrine. So I think it's called Zebra Talk, and I'll try to provide a link to that. I have the CDs if you come to the meeting, because it's also an ebook, but that worked on NET acronyms.
Rob, that's a.
Yeah, you would be impervious to it, but no.
Yeah, I think, well, it's a great point, and I think certainly something for those of us who sit on guidelines committees and patient-specific, patient-centric organizations. I think I'll volunteer you to help us, but I think it's a great suggestion. Yep, and then we have time, so we'll get together.
results in. And have something meaningful. What,
So the
Shall we do something?
question was around, is there a primer on statistics language? I think I need that too. I don't it's so that's a confusing area even for physicians, but I think that could perhaps be included in the type of guideline and sort of a translator essentially for patients. Do you have a comment, George?
Only that we try to teach our fellows to read the materials methods first, because that's where you learn how efficacy trials describe or define PFS, and you're right, it can be defined in some different ways. And I think that gets into the weeds of our research a little bit. And we try to reinterpret that when we talk about putting things out there in guidelines or how to sort of filter for what we're looking for, what we digest in key cases. So that's critical for research, and I'm not sure that our patients have to read statistics on how these endpoints were arrived at. At least I hope we're not.
But those are things you can ask your docs. I mean, I think that if you want help in interpreting, yeah, that's probably true.
So both Carrie and I, Carrie's in here somewhere, sit on the NCI task force for neuroendocrine, but as part of that, we're also duly enrolled in the patients task force and the NCI, and there are materials there. And I will try to see, I do remember I do think they have a lay person's kind of guide to understanding clinical trial information. Because it's not just understanding PFS, but also understanding how to read inclusions, because I think the big challenge in a lot of these is there are different inclusion criteria, which may really change why different trials have different results, even though in the placebo arm of 2 trials having radically, a 7-month difference in progression-free survival, and would help you understand that, and that's not something you necessarily would get teased out by your clinician unless they knew that you were questioning that.
There was another question over here. Anyone? Yes.
Right.
Do you want to repeat that?
Yeah, Maria, you can tell people.
Anybody who has a diagnosis of cancer can get a copy of the journal Cure or Caring. And one of the editors, or the editor of Cure, is Dr. Deb Chapathi, who was at UCSF, and he really explains cancer terms in layman's terms.
And then he was
and then he also does.
He's now at MD Anderson. He was at USC for a long time as well. But
UCSF.
Yeah. No, he's now at MD Anderson in Houston, but he was at UCSF.
Right. But anyway, that magazine is fabulous for those two anyway.
Great points.
MDAnderson.org is a very definitive website, and you can get a lot of definitions from MDAnderson.org at Houston Medical Center.
Great. Well, and I think as Carmen was saying, these sort of academic-based websites, I think, are pretty reliable, and I think that those are, wherever you're getting care, many of your local institutions, if they're academic, may also have great resources on them.
I was going to say, the American Cancer Society, also on their website, does have a glossary of terms. It might help, may not be specific to your type of cancer, but it does have a nice selection of a nice glossary.
Yes.
I just visited the University of Google, and at Aspire Hospital, aspirehealthcare.healthcorp.com, they have a layperson's guide to scientific studies. To help you understand statistics and all that sort of thing. As well as health.gov has a similar resource.
Yeah.
Thank you.
Great. Thanks. Misha. Yeah.
I just wanted to mention one other thing which I hadn't heard, which is I think a lot of people do not know about Google Scholar. I can't tell you how many people even in my classes when I'm teaching, I say that the practitioners don't know about it. Google Scholar is an excellent resource. If you search, even if you search in Google, the things in Google Scholar will not come up unless you use that specific search engine.
Great, thank you. Dr. Cohen is one of our upcoming speakers, so thank you.
Yeah, I might add about Google Scholar, just glad you brought that up. You can actually search for a time range. So you can just, you start searching, you might get articles from the 70s or 80s, but what's nice with Google Scholar is you can actually put the time range in there.
Great, well, thank you. What a great session. So thank you.